A 16-year-old boy comes to the ortho clinic with pain around his knee. He says it started after a football match. So everybody sort of assumes it's because of a sports injury. But weeks later, his pain just gets worse. And now there is a swelling above his knee. An X-ray is ordered, and this changes his life forever. If you have read The Fault in Our Stars, you may remember Augustus Waters, who lost his leg to osteosarcoma. Today, we'll start bone tumors. I'm Nabeel. This is Pathocyte. When it comes to bone tumors, metastasis from other malignancies are the most common, like breast, lung, prostate, etc. In primary malignancies, hematolymphoid malignancies are far more common than other bone tumors. Primary non-hematolymphoid malignancies are the least common among these three. Here in bone tumors, we'll be focusing on these tumors, the primary non-hematolymphoid malignancies. Bone tumors are diagnosed with the help of four things. One is age, then location of the tumor, X-ray findings, and fourth, the histopathological findings. Age and location can sort of give you a very good clue towards what the diagnosis is. For example, if the tumor is around the knee in a young individual, you can think of osteosarcoma. Whereas a tumor around the hip joint or the pelvis in an older individual may be usually chondrosarcoma. Before we discuss individual bone tumors, let's first look at a brief classification. Bone tumors can be broadly classified into bone forming tumors, cartilage forming tumors, and aptly named unknown tumors. And each of these three are divided into benign and obviously malignant. Bone forming benign tumors are osteoid osteoma and osteoblastoma, while cartilage forming benign tumors are chondroma. You can connect these: osteoma, bone, chondroma, cartilage, omas. Here it is osteoblastoma. So cartilage forming one is chondroblastoma. Malignant bone forming tumor is osteosarcoma. This is the most common primary non-hematolymphoid malignant tumor of the bone. Now, cartilage forming malignant tumor is chondrosarcoma. Under unknown category, giant cell tumor or osteoclastoma is a benign tumor, and Ewing sarcoma, this is the malignant one. Now there is a fourth category called tumors arising from the notochord or notochordal ones. Under that we have a malignant tumor called chordoma. So bone tumors are divided into bone forming and cartilage forming, then unknown, and a fourth category notochordal. Under bone forming, the benign ones are osteoid osteoma and osteoblastoma. Similarly, under cartilage forming, the benign ones are chondroblastoma and chondroma. Then under malignant ones, the bone forming one is osteosarcoma, and cartilage forming one is chondrosarcoma. Under unknown tumors, we have giant cell tumor, which is benign, and Ewing sarcoma, which is malignant. Now that you have understood the classification, it's time to move to osteosarcoma.